Getting ready for surgery and wondering about your recovery? Or maybe you've just had surgery and you're wondering what's next. In this video, I'm going to be talking about the first few days after surgery for breast cancer, whether it's lumpectomy or mastectomy, and I'm also going to address what happens after sentinel lymph nodes or axillary lymph node dissection, because that's usually part of the whole process. Before I go on, I would like to invite you to subscribe to our channel because we're always putting out new content. And I'd also like to invite you to go to Yerbba.com to get your personalized report. Your Yerbba report takes all the information that you either upload to our platform or give us permission to access through your electronic health record. It then creates a report of everything we know about your cancer and the treatment options you might hear about when you go to the doctor, whether it's chemotherapy or endocrine therapy, radiation therapy, or targeted therapy. It lets you know what the pros and cons are of each treatment and also provides you a list of questions you can choose from to ask your medical team when you go to your appointments. I really love this feature because it shows you, yes, these are normal questions, and can also create a nice dialogue between you and the members of your medical team. So let's talk about recovery. Again, I'm going to focus on the first few days. After recovery, it's very likely that you're going to go home with dressings, so a bandage over the surgical incisions, whether it's a lumpectomy or mastectomy, as well as your armpit incision if lymph nodes were removed. You may also have a drain. This is a very soft, floppy, if you will, tube that goes into the area where the surgery was done and tissue was removed to drain the fluid that your body makes as part of the normal healing process. Without a drain, some people get so much fluid accumulated that it's really uncomfortable and they have to go in and have a needle put in to drain that fluid. A drain helps drain that fluid out of your body so that it's not accumulating in the surgical area. Most people, once the drain is removed, don't need additional drainage, although it's not uncommon to require a drainage procedure or two, or sometimes even more, in a relatively uncommon group of people. After lumpectomy, it's unlikely that you'll have a drain unless you had a full axillary dissection, but everyone's different. And if you went home with a drain, it means that the surgeon saw that this area was very likely to need a drain. And if you don't have a drain, it means that the surgeon is pretty confident that you don't need one. Your care is personalized in the operating room, just like it is at Yerbba.com. You will go home with instructions for how to care for your wound. Your surgical incisions are referred to as wounds. And you'll go home with information on how to take care of it, how to clean the area, when you can remove the dressings, when you can shower, what to expect, and instructions for when to call your medical team. This part's really important. Don't let pain in the area or excessive drainage or the drain coming out, fevers, redness of the area. Don't sleep on those symptoms. You should call your medical team, and the instructions will tell you specifically who you should call and also any particular reasons to call your medical team. So take a look at those when you go home. You're going to be very stiff. You've had surgery. Even if you don't have armpit surgery, you're going to have stiffness either after a lumpectomy or a mastectomy. I do want to say that most people who have a mastectomy are told that recovery is longer than with lumpectomy, but that's not true for everybody. So if you go home after a lumpectomy and you're having more trouble with recovery, it's not that you've done anything wrong. It may be the amount of tissue that was removed or the location of the incision. It doesn't mean that you're odd or that you've done anything you shouldn't have done. In terms of what you are able to do in the first few days after surgery, you'll be advised not to do a lot of lifting or a lot of movement. On the other hand, we want to make sure that you don't become less flexible in your joints, especially the shoulder joints. So once you're able to move, you'll actually be encouraged to move. You don't want your shoulder to get frozen if you had a lymph node dissection, but you'll often be seen by your surgical team before you're told to go ahead and move. You want that drain out, for example, and we want to make sure that the incisions are healing really well before you start putting any stress on the skin. Once you're given the go-ahead to start moving the shoulder and the arm, it's important that you follow through because you don't want to develop a frozen shoulder, as I mentioned, or otherwise decrease range of motion. You'll get specific instructions on how to do this, and if you need extra support, a physical therapist or an occupational therapist may be somebody you can be referred to, but it's very likely your surgical team can give you guidance along the way. You do want to avoid overexertion, so if you're told you can start lifting things that weigh 5 pounds, stick with the 5 pounds until you're told you can increase the weight. Again, we want those surgical incisions to be nice and strong before you start putting any stress on them. Let's talk about the emotional impact of having surgery. After surgery, your body's going to look different, whether you had a lumpectomy or a mastectomy. Obviously, it will be more profound with removal of the entire breast, especially if you don't have immediate breast reconstruction. Waking up without a mound where your breast used to be can be a shock to people, and many people will be with a supportive person when they first take the dressing off and see themselves without a breast. It can be important and helpful to have somebody who loves you and accepts you just the way you are to be with you. Other people want to take the dressing off in private or with a nurse, somebody who comes to the home to help with surgery, post-operative care. Everybody's different. Listen to your gut, and there's no right or wrong way to go about this. Your body image is very likely to change. If you've had a mastectomy, some people feel that their body isn't desirable or attractive. Give yourself some time to adjust. You're not alone. This is where a support group can be helpful, or seeing the social worker in your practice who's really comfortable talking to people who've had losses of a body part and of body image. I'm not going to spend a lot of time on long-term recovery, but I do want you to know that things almost always get better. If you have lymphedema, swelling of your arm after surgery, it's important that that get treated early. You're not complaining. You're reporting that your rings might be tighter or your hand is stiff or puffier. It's really important to get treated for those symptoms early. Don't hold off. Just because you're free of cancer doesn't mean you're not suffering. The other thing is, it's important to enter back into your life as a whole person whenever and as soon as you can, while also giving yourself grace and being gentle with yourself. Other treatments that will come after surgery will become clearer once the pathology report is available. This is where going to Yerbba.com and getting your personalized report can be really helpful if you haven't yet found out if you'll be having chemotherapy, targeted therapy, endocrine therapy, or radiation therapy. We can get you prepared for things you might be offered in your follow-up appointments. I covered a lot. I hope it was helpful. Thanks so much for watching, and we'll see you next time.